Imagine suddenly awakening to hellish pain, and you try to scream, but your voice doesn't obey. It's then that you realize that your entire body is paralyzed. Every year, about 30,000 patients suddenly regain consciousness on the operating table. So why does anesthesia suddenly stop working? Generally, anesthesia consists of three components. The first is anesthetics, which immerse the patient into a kind of sleep and relieve him or her from storing memories. The second are the so-called relaxants, which paralyze the skeletal muscles, allowing the surgeon to work without interference. Finally, a state of narcosis is achieved using analgesics and narcotic anesthetics. These drugs completely block the passage of painful nerve impulses. At the same time, the mixture should not lead to malfunction of the cardiovascular, nervous, or other bodily systems. An anesthesiologist devises an individual, unique cocktail for each patient. So, quite obviously, mistakes in dosage are quite possible. Anesthesiologists from the UK and Ireland put together a report regarding about 300 cases of the unsuccessful use of anesthesia. The researchers reported that many patients had nightmarish memories of unbearable pain and suffocation. In 1998, one Carol Vire woke up during an operation to remove her eye. The unhappy woman tried to scream or give some kind of a signal to the doctors, but she couldn't move an inch. And, horrifyingly, the operation lasted for 5.5 hours. Every second of the operation became for Carol an unbearable torture. She repeatedly went mad with the pain, lost consciousness, and came to again. This was repeated over and over and over. Another patient, June Carson, after also waking up on the operating table, could not move or make a sound. But the woman clearly felt the surgeon's knife. 15 minutes after the onset of her suffering, her heart stopped. Fortunately, the doctors caught on in time and restarted her failing heart. But the greatest fear for most people, they said, was inspired not by the potential pain, but the paralysis. Many thought that they had been buried alive. One patient went into surgery to have their leg cut open, and the surgeon needed to drill into the bone. The patient was given anesthesia, but it didn't work properly. The man was fully conscious, lying there on the table with a tube down his throat, unable to move. And yet, he contrived to make some kind of a sign to the doctors by wiggling his toes. The nurse noticed the wiggling toes and alerted the surgeon, but the doctor said that the toe movement was only unconscious reflexes and began the operation anyway. From the unbelievable pain and mental trauma, the patient soon stopped breathing. However, the physicians immediately connected him to an artificial respirator. But nothing can be compared to what has been experienced by newborn babies. In Europe and the US, babies for many years underwent operations without any anesthesia at all. And there was an opinion that the nervous system in newborns was almost completely undeveloped. And as such, they did not feel anything. Only in the 1980s did the members of the American Society of Anesthesiologists finally declare that newborn babies could feel these surgical interventions. When improper anesthesia is administered, after awakening, the patient can hear, see, and sometimes even move, but not feel any pain. In this case, the anesthetist has undershot on the amount of anesthetics and relaxants. However, doctors are likely to quickly notice an early awakening of the patient and add in the necessary components to the anesthesia. A person usually doesn't have strong memories of the experience. Another scenario is, having woken up, the patient can feel neither pain nor his or her own body. It might even happen that the surgeon doesn't notice the awakening of the patient until the end of the operation. But since there's no pain, the patient will not suffer serious psychological trauma. Sometimes after awakening, the patient can feel pain and can move. This condition, though, is quickly recognized by doctors and they instantly add more anesthesia. Worst of all, though, is if a patient wakes up, can feel pain, but because of the paralysis, cannot report it. In this case, the dose of relaxants is sufficient, but the other components of the anesthesia are not. This can cause tremendous suffering to the patient. And after the operation, the patient will most likely have to struggle with mental disorders, insomnia, and nightmares. But probability of awakening under the scalpel is a negligible 0.008 to 0.2% of all operations. And in approximately 80% of all such cases, the patients don't remember anything. But it's also possible to carry out complex operations without anesthesia, but without the patient feeling any pain or stress. Neurosurgeons from Germany have even been able to operate on parts of the brain of fully conscious patients. This helps doctors to destroy tumors without damaging important parts of the brain. During the operation, the doctor can simply ask the patient to speak, count, recognize faces in photos, or even to just lift a finger. Such actions are necessary to identify areas of the brain that shouldn't be touched during the operation. This new method has become indispensable in the case of contraindications to general anesthesia. For example, with exacerbation of bronchial asthma, angina pectoris, and some neurological disorders. The percentage of operations done without anesthesia is still quite small. But with the development of these new technologies, their number will undoubtedly grow. And someday people won't have to suffer the long waking up and recovery period after anesthesia. And even with the most serious of operations, we'll go to a surgeon for only a short visit or a couple of hours and casually stroll home after.